So when should you see a psychologist? So I get growing concerns sometimes from potential patients and clients. So on an emotional and mental health concern level, if there's a persistent feeling of sadness, anxiety, anger, numbness sometimes, overwhelming distress, worrying that interferes with daily life functioning, with different areas of your life, work, study, family, frequent mood swings or emotional outbursts, feeling disconnected sometimes from reality or feeling dissociated sometimes. Thinking about thought patterns as well, thinking about different thought patterns, repetitive, intrusive thoughts, distressing thoughts, compulsive thinking, addiction-based thinking, engaging in behaviors that you think are unstoppable or difficult or too much of a challenge, trouble concentrating, making decisions, trouble staying organized, negative talk patterns, low self-esteem, difficulty making decisions, self-blame sometimes can be a factor. If there's changes in your daily functioning, simple things like hygiene and grooming, trouble sleeping, basic functioning, too much or too little sleep can be an issue. Changes in appetite, weight or energy levels can be noteworthy. Withdrawal from friends is a big one these days. When people start feeling unwell, they find themselves disconnected from messages, emails, social contact, family activities, withdrawal from family activities, community activities, difficulty keeping up with responsibilities within work context, study related, or just at home. Relationship and other social difficulties, like if there are ongoing conflicts in relationships or difficulty trusting others, feeling isolated, feeling unsupported, feeling like no one understands can be a factor. Challenges with parenting, family stress, or having difficulty communicating or understanding, or if there's, put another way, when there's issues with miscommunication or misunderstanding can be a factor to think about. Struggling with boundaries and feeling like there's a lot of people pleasing going on and not enough time for me type of thought processes. Life transitions, if there are major life transitions or traumas that we're holding on to, whether they're micro traumas or major events perhaps. Grieving loss and bereavement can be a factor. Dealing with a breakup or major life changes, processing some of this trauma, abuse, potentially difficult past experiences can be something that can have an effect on our mental health and well-being. Adjusting to a new role, whether that's new parental roles or migrating from place A to B or country A to B. Divorce, that's a big life adjustment. Retirement, the loss of a loved one could be something that thrusts you into a new role. Cultural identity struggles, spiritual crises and identity struggles can be a factor. Some mental health red flags could be, thoughts of self-harm, suicide. So we need to seek immediate support for that as well. Using substances, alcohol, drugs, engaging in more behavioral addictions, digital addictions, screen addictions. Feeling stuck and hopeless can be a factor, like things will never improve type thought processes. And these are some thoughts that I wanted to share about the question relating to, when should I seek support? When should I seek help? When should I see a psychologist? So we can assess for these, and maybe you can kind of go through some of these, rewind, and just kind of track back and see if you tick some of these boxes, and that could be a kind of a little activity for you to self-assess if that's going to be of help to you to make a decision about what to do next and to help you with your help-seeking decision, inshallah. Take care.